in our specialties, the digital technologies available to us, and mainly to focus on the need of magnification in digital dentistry, how the magnification plays a major role, and the intraoral scanners, the digital workflow. It is not just the intraoral scanner, it is the digital workflow. And my experience with these two products, that is AORALSCAN 3 and AccuFab L4D, which is a 3D printer. So the need for digitalization dentistry is really the need of the hour, and these are the most important things why I chose to go digital. One is that it helps me in assisted diagnosis and patient education. In today's world, until and unless we bring in transparency, the acceptance of the latest treatment is not possible by the patient. So patient education is a key factor. Precision, which is another important factor for us, because we do not want to have retreatments. If I want to do a good treatment, and that treatment has to last. And predictable, I'm able to judge my work whether it is predictable or not. And the most important thing is that I'm able to do biomimetic treatment approaches. We are now able to restore teeth exactly the way the natural dentition or the tissues are without affecting or damaging them. Better prognosis and better communication with the labs and faster turnaround time. Today's the patients demand a lot of things from us, that they want a quick fix on things. Is it possible? That is only possible with the digitalization in dentistry. So I recently published an article which emphasized today is the era of digital dentistry. You can look at this link. It is Journal of Restorative Dentistry and Endodontics, where I spoke about the role of digital dentistry in today's dentistry. The whole idea is that you need to digitalize everything, from the search of the patients in Google, which is digitalized. The patient expects everything to be on a fingertip. So I will just talk about the whole array of things which plays a major role. So coming to this need for digitalization. So why do I need this digitalization is that we were introduced with digital technologies way back with the introduction of RVGs about 20-25 years back. And now we have whole array of things, which is the orthopantomograph, CBCT, intraoral scanners, lab scanners, facial scanners, 3D printing, and CAD-CAM. So all this digital technology enable us as dentists to do a better work. So one of the main focus is that, as Clara mentioned, in the Indian subcontinent, we have introduced a digital platform which will enable dentists to keep the records, and patients will also be able to access the dental records. You can visit this website to know more about this digital platform. This digital platform is bringing in transparency to the patients. So the patient's acceptance to the treatments, easy exchange of records, and all the electronic health records are developed based on the case history or the digital documentation by the digital codes recommended by the WHO. So coming to the most important aspect for us as a dentist, how does it assist us in diagnosis? I have never been able to show, I am a microscope user. I take a 3D picture or I take a microscope picture and explain to the patient, but I never get a 3D image of a microscopic picture. If you look at this picture, there are three different restorations. One is the amalgam, one is the composite, and one is the glass enamel. You're able to appreciate the failures of these restorations and how the previous dentist who's performed is done his job without the use of magnification. Maybe this patient walked into me saying that he had a food lodgement, but I was trying to tell him before I start, I need to document. I said, this is how you present to me. And what I'm able to show him is that the restorations are failing because of various reasons. So if you look at this, after removing of the restorations, I'm able to demonstrate how the caries looks. And I'm able to three-dimensionally help him view, because I'm able to rotate with the help of the image from the scanner and also show that there is caries underneath these restorations and this needs care. And finally, after removing the restorations, I was able to show him that there is a bleeding spot. So that requires a proper treatment for him to further proceed. So what is my emphasis? Till now, I've never been able to get a tool the way I'm able to show things to my patient and able to get my results, which was not possible with any of the technologies in the dental field. If you look at this, what I liked about this picture is able to show that the lesion is active and this is an arrested lesion, which also not only helps in the education of the patient, but also helps me to diagnose what should be my treatment approach. And an image like this is shown to patient, the treatment acceptance of the patient is great. The other important feature which I was able to understand is this particular scanner which I'm using is able to generate an oral health report digitally, and I'm able to immediately share this report to the patient. So this becomes transparency in sharing the reports. So this report also educates the patient, telling, for example, if he or she has got a missing tooth, it tells him what are the disadvantages of having a missing tooth and if it's not replaced. The other advantage is that if you look at this, it will also show that there is a removable orthodontic appliance. It will suggest what treatment needs to be done for the malocclusion. This is how I'm able to get a QR code where the patient can scan the QR code and get all these reports in 3D format. He or she can rotate the jaws, see his or her problem. So this is the greatest thing which I have discovered in patient education, and also we as a dentist find it difficult to talk to them. A picture speaks 100 words than by we convincing them to go ahead with the treatment. The other important thing is recently WHO published oral health report which says more than 50% of the world's population is suffering from caries and gum diseases or the dental diseases. So how will we educate? We need a tool which can actually make them come to dentists more and more and visit us frequently to maintain a good oral hygiene. And we all know that we are working in this field for a longer duration of time, and we are not able to emphasize this to our patients. They all only come to us only when there is a problem. So what are the applications which I am able to use this digital technology? It is starting from diagnosis, and I think most famously it was introduced in orthodontics, but the applications are numerous. It can be used in all these specialties, and today's focus is on the restorative dentistry. So how does magnification play a big role in digital dentistry? First and foremost, for all of us, it is the precision, it is the skill based. Our profession is entirely rotating around the kind of quality of work you deliver. So precision is the utmost thing why I chose magnification over almost 18 years back now. And the next thing is the ergonomics. For us to have a longer professional life, you need to maintain good ergonomics, predictable results, and enhanced clinical skills. If I may just play this video, you can appreciate the kind of precision I'm able to deliver when I'm doing a tooth preparation. I'm able to go through the smooth preparation of the margins in a way that I'm not damaging the gum tissue. If you see, my movement of the burr is so precise without damaging the adjacent gum tissue, and I'm able to prepare it and comfortably do this sitting at almost 12 o'clock position. If you have noticed, my movement of the burr is so precise and so minimally invasive. This was taken under the OPMI Pico Carl Zeiss microscope, and I thank the quality of magnification which I enjoy in my day-to-day life. So my practice is based in Bangalore, and it's a microscope-centered practice. From the way the patient walks inside my clinic, I tell them what I'm specialized in, which is mostly minimally invasive, and try to project myself as one of the dentists, or all of us, including all the people who are presenting today or listening to my webinar, should market them and tell your patients that how well or what you are specialized in. So if you look at the medical profession, they always talk about keyhole surgeries, but how do I talk about magnification? And the introduction of all these technologies should be a role in marketing yourself. So the era of modern dentistry needs everything in place. It's not that you buy a technology in bits and pieces, it has to be holistic. So a setup like this is what is expected, and it will ease our stress levels. Today, why I chose magnification and digitalization is to ease my stress, not to have repetitions in my routine work. If you look at this, the way the magnification is helping us when you're using a 2.5x loops is on the ergonomics part. If you look at this, I'm sitting comfortably at 12 o'clock position and I'm able to deliver a good quality of work and not having stress at the end of the day. So ergonomics plays a major role in when you choose your equipments and this one. So when it comes to a microscope, you're still able to sit at fully straight, where your ergonomics is much superior than compared to that of your loops, and you're able to deliver highest quality of work possible. So even if you're going to go into digitalization, ultimately dentistry depends on the clinical skills. If you're not able to do a procedure, and then the digital technology will only capture whatever you have done, it's not going to modify anything. It is just going to capture what you have prepared. For you to achieve best results, you have to at least have a minimum 2.5x magnification, so that your digital technology will not slap you back and say that go back and do and correct this. So that is one of the major things why you should upgrade to magnification, at least with a 2.5x. Coming to today's main focus, what is the role of this intraoral scanner in our day-to-day practice, in our routine practice? Maybe restorative dentistry is the focus of this presentation. How this intraoral scanner, it is the opening door, or it is the stepping stone for entering into the digital world. And this is helped me, and I'm going to share how this technology is helped me upgrade in my digitalization. So one of the most important thing why you should choose, and when you choose your scanner, what is that most important thing which you should look at is the speed and accuracy. Because there are a whole lot of things. When you pick up your phone, you look at the quality of the camera, you look at how this image can be transferred. The same way, it has to be ease of, when I upgrade to a technology, it has to be ease of upgradable, and it has to be very important for us to have an accurate process. It's that we are jumping in from a conventional impression technique to a digital process or an optical impression, but that should not compromise the quality of the work what it is, what I or you have done. And when you pick up a scanner, there is a less of post processing. Unlike your conventional impressions, you have your whole work is dependent on your assistant who does the initial pouring of the cast or your rubber based impressions, and then transfer to the lab, the time it takes for the lab to receive the thing, and then there is a lot of turnaround time. The other thing which is very, very important, where the patients have started appreciating, is that the thing is just over. They're just going to ask, where is the impression? I said, this is the impression. And the greatest advantage is most of the patient has this gagging reflex, and they are not tolerating conventional impression. Me upgrading to this is made a whole lot of change in my practice. The other thing is patients having limited mouth opening, where you're not able to insert your trays and record most of the tissues distal most to that of your teeth. And the patient education, as I mentioned to you, it helps us to increase our practice, the growth of the practice. Patient, him or herself, will start asking, what is this which is black in color? Should I get this treated? And the best part is that ultimately at the end of the day, you have the wow factor, which is the appreciation from the patient and your own mindset. You feel really elated at the end of the day. So, as a dentist, we were always looking at when is this going to end. Me as a restorative dentist, we were working on alginate impressions, and then we were introduced by silicons. But silicon has certain problems. When there is an excessive bleed and I need to arrest it, there's a longer duration of time where I'll have to wait after putting it in the mouth. If there is an error, I'll have to keep repeating this impression again and again. The best thing what the patient enjoys is that he feels that it's so comfortable. The most important thing why patients neglect coming to dentist is looking at the armamentarium we have and the protocols what we follow conventionally. By upgrading to digital, the acceptance of treatments will increase. So when are we going to change from this age-old practices of conventional impression taking or process of digitalization? So after you have convinced yourself, most of the people who are attending today will be looking at, should I buy a scanner? And we have been bombarded by many scanners in the market today. And this scanning technology is about 10 years old, which is just started to come. There are generations of scanners. This scanner did that, that scanner did this. At the present generation, how do you choose? What are the factors you'll be looking into when you're picking up your scanner? So here, first and foremost for me is the speed and the flow and the ease of use. You can see one of my senior doctor colleague who's been in dental practice for over 50 years was able to use this technology seamlessly, right? I thank Dr. Kurian for using this technology and giving his feedback, saying that it was very easy for me. And a person who was stalwart in dentistry, practicing for over 50 years, I take his comment as a commendable thing, and I would say that every dentist should upgrade to a digital technology because the process and ultimately the patient care improves. The accuracy and ergonomics. When I'm holding my scanner, the scanner should be as good as my handpiece. I don't want anything bulkier because if it's bulkier, I'm not able to move it all around the mouth. The scanner does not have a contra-angling like your handpiece, so it will not go to the corners until and unless it is sleeker and the weight of the scanner is less. I will not be able to move around seamlessly. The next important thing all of us should understand, this scanning technology is based on the software, the ability of the software to do most of the job. When you're assessing your scanner, the software plays a major role. And ultimately, what comes is the affordability. How expensive is this particular technology for me to upgrade from my conventional routine impression taking? Yes, it is definitely better or good, but can I afford this technology and implement this into my day to day practice? The other thing is the brand and the service support. When I buy a technology, I should know how long this technology will last and what is the lifespan of this technology. If you don't put all these things, there won't be a return on investment of whatever technology you're upgrading. So when I chose my scanner, I evaluated all these factors before picking up my scanner. So I had my personal evaluation done on my mouth. I thank one of my colleague, Dr. Upendra Oshing, who assisted me to help me understand to some technologies which he's been practicing over 2 3 years now. And these are the various scanners which I personally evaluated before picking up my scanner. So if you look at every scanner which is available in the market was tested and tried for me. I took over 6 to 8 months to really understand which is the best scanner which will suit me. And I waited and I had an opportunity to first try the AORAL scan, and I also tried the latest scanners which are available in the market as well. And I have my feedback. Maybe we can take these question answers as we move on at the end of the presentation. But all scanners scan. But what is good for you and me is what we need to understand. As I mentioned, the factors which you need to pick up. So when I was doing a research of my own, I always like to look at a little bit on the internet, and I found some data of the scanner which I picked up, that the AORALSCAN 3, and from the Institute of Digital Dentistry. This is the feedback given by this institute, which is given a speed of scans, scan flow is good, size of the scanner, ease of use, scanning software, and the investment cost. All the other things are well displayed here for your understanding, that it does not have a caries detection. At this point of time, it's a wired scanner. And the ability of the scanner, where the scanning data, whatever I capture, what I do next with that is also equally important. And these are some of the images taken from the Institute of Digital Dentistry, where all the scanners were compared and the accuracy of the scan was measured here, and where the AORALSCAN from Shining 3D showed excellent results as comparable to that of any other scanner which is in the market. This is the tessellated mesh with all the vertices. If I look at the scanners, it is almost comparable. There is nothing that shortfall which I found in the Shining 3D, and I can also show you my own pictures taken up. The quality of the scan picked up in a, if there is a bleeding area, I can see the different restorations. I can see the damage. This is a retreatment case. The other thing which I also wanted to evaluate because before picking up the scanner is how many dentists worldwide are using the scanners. This is a survey which is published by American Dental Association, which said there are in the US there are 53% of them have upgraded themselves to the intraoral scanners, and the 47 have not. And the main three reasons of picking up the scanner is to improve the clinical efficiency, right? See, which you all know that the conventional techniques do not help us achieve that. The other thing is 59% showed that there's a transition from analog to digital practice and improved laboratory communication, which is one of the greatest problem today we have in the Indian subcontinent as well as I think the worldwide. Whatever you have done, you're not able to get it back the way you want because the lab processes hundreds of work and you're the only one. The other thing, say the other dentists not upgraded to the technologies that because so we should always question this decision when we update technology is that how affordable it is and what is that we are trying to achieve. And so I decided after doing my homework that I need a scanner which as I mentioned to you, is the stepping stone as a whole digital workflow which I'm looking at. I need a scanner which has come up I picked up Shiny 3D because they have a whole array of digital technology and it is easy for me to operate day in and out rather than looking at a process wherein I buy a scanner from one particular company and I buy another digital technology. There are sometimes hiccups, but there is a smooth flow. That's the reason I chose Shining 3D. The other thing which I like about Shining 3D is a complete online support. It's been over a year now. I do not have any problems. If there is an issue, I raise a ticket and I'm able to get my problem sorted out from an online support. And there's a constant upgrade of the software. So there is no involvement of any dealer or let's say a reseller who comes and he needs to visit your clinic to come and help you sort it out. There is a complete online support. So I'm going to share about my experiences with Shining 3D AORALSCAN 3. In one word, what I would like to, put a USP is that saying that it is a super fast and an accurate scanner. And I've done over 200 scans and I'm only telling this after evaluating personally. So what I like about the scanner, it's ergonomic. It's easy. The way I holding the scanner is as good as you and I hold our hand pieces, which we are trained to. It's lightweight. It's 250 grams plus or minus compared to the wire. The depth of the scan is really good. It's able to capture a good depth of the tissues as we use various situations where we have an undercut, as I'll be explaining in my next few slides. The other important factor which impressed me about the scanner before picking up is the hygienic. So when I touch and finish my upper scan, moving to the next scan, I had to usually go back and check the computer with the other scanners. But here, I'm able to seamlessly just move the scanner left or right, and I can go to the next scan or do whatever I want to do. So this is a very hygienic feature. And when you're doing scan, your assistant is not around or anybody is around, you can still do the scan without having any assistance. See, the other important factor which I would like to stress here is the size of the scanning tip head. There are two tip sizes which are available. This smaller tip size helps us to scan the distalmost area. The other thing is that it is 15% longer than the any other scanner which I've evaluated. The tips are long enough for me to go and capture the distalmost area. If you look at this picture, I was able to comfortably scan the third molar area, which is not possible generally with most of the scanners. And I was seamlessly able to capture this, which will not happen with your conventional techniques. Usually when we have to do a crown preparation or any restoration to do with the third molars, we always have a challenge taking multiple impressions because we cannot capture the distalmost area. So what is a scanning protocol? See, we have a scanner. We need to understand what is the minimum protocol at least before buying. Scanners will capture, but as a dentist, you and I should understand what this technology can offer for us. First and foremost thing is isolation as much as possible. isolate the area which you're scanning, scan scanner positioning. The scanner has to be minimal paced around 2 millimeters away from the tissue which you're capturing. It's not that you place it away and then the scanner will tell the job. And always look into the monitor more than looking into the mouth. You will get used to it, because you need to not unwantedly hold the scanner too long in one area, because the data will increase and the computer, what your file size will increase, and then you will find it difficult to send it to your lab or exchange of the data. It will still capture, but unwantedly capturing. It's like you're wasting your time if you're just looking into the mouth, because you don't know whether the scan is done. So always looking into the monitor helps and needs practice, especially when you're moving around in the anterior region from one aspect of the arch to the other aspect. That is one of the things which I like about the AORAL Scan 3, where there is no pause or anything. If you can just look, I tried capturing a picture for you the way I scan it. If you see me holding the scanner, it is so seamless, and I'm able to start and go so fast. If I'm holding the scanner at the distal most tooth, I'm able to immediately finish even the premolar. The scanning area is much faster, and also it's better. If you see, it is more of your wrist movement which you need to practice when you're scanning those areas. And I'm doing a partial scan, I'm not doing a full mouth scan on this patient, because when you're working on one side, or you have a single restoration, always recommended that you do a partial scan, and that is good enough. So that is what digital technology has helped us to achieve as well, the accuracy. This is the motion sensing capability. If you see that, I'm able to move the scanner and I'm now able to go and capture my lower scan. And I always recommend that you learn to sit and do this. I have seen many of people trying to stand and do, because we are used to standing and doing the impressions, but sitting and doing is made make things better, because your viewing angle into your computer and moving around the tissues. If you see that the way I'm holding my scanner and slightly gently reflecting the tissues, I have a single button which is just pressed twice and then moved on to this. So I'm now trying to capture the bite. I think you all would appreciate the speed of the scan. The scan is quite fast in capturing. The best part is when I'm doing my bite. It is super fast when it's doing its bite, and it's done. And now my scan is ready. I wait for the software to just give me the final image. It's processing the image. It'll just take few minutes. Within about 2 minutes, I think 2 to 2.5 minutes, you can finish the complete scan of the mouth. That is what I have been doing. But most of the time, since I'm doing restorative dentistry work, and I love to do a partial scan rather than doing a full mouth scan. So now the image is ready for me to visualize if there are any unscanned areas, but I don't see that usually with the oral scan 3. The data is ready for me to just export now. Yeah? And I can show the patient in all the views, all the directions, which no other technology till today helped us do for this. So here I would like to make a mention. There is a good guide in the scanner. When you're away from the scanning area, it shows a red kind of a thing saying that you're not holding at the right area. And when it shows the green signal here, it tells that you're scanning, and the way it happens. So this is something which also helps us to have better our learning curve, so that you know where exactly you're holding it. That is the role of the software. So the same scan which I just showed you on the video, this is the quality of scan what I get. The color contrast, the tissues matching, it's really amazing. The time taken is very minimal. So there are type of scans in restorative dentistry which we practice. One is a full arch, a partial arch, and the bite registration. So this is the bite registration what you can capture, and the images just occlude as like a blink of an eye. So what is the protocol you need to follow? Recommended is that you start from the distalmost area on the occlusal side. You run the scanner throughout and pass the other arch. Then take the buccal side, finish the buccal scan, and then come back and then finish your lingual scan. This is the scanning protocol. This flow helps us to capture the tissues maximum with minimum amount of errors in your scanning. Same thing with practice, you should be able to do both the upper and lower scans in about 2 minutes. So the challenge is when you're changing or shifting is very difficult. As I mentioned to you, the scanners are all not having any contra angling. When you're moving in these areas, you will find that the scanners, when you evaluated the scanners, the scanner quality or the scanner is of not that good. There'll be a sluggishness where the scanner struggles to capture this area. So that I've never found in Shining 3D. It just moves seamlessly into this region. So when you pick up your scanner, I would recommend you to check especially this part of it, which was shared by a senior colleague, Dr. Upendra Oshing, because he's been using technology for some time. And that is one evaluating factor as you and me as a clinician should check before buying the scanner. So this is the byte registration. When you're doing the byte registration, you should move your scanner zigzag and not just hold it there in place. So this will evaluate and achieve a better scan without any errors. So this is the scan of the byte. So the amazing features of this scanner, AORALSCAN 3, is that it is very, very lightweight, very small enough and ergonomic, and it has got telling a light saying that whether the scanner is awake or sleeping. That's another important feature you need to have in your scanner. And a good amount of anti-fogging. See, when I pick up a scanner, the scanner works on a mirror. So there is a fan which is sitting inside and cools, and also there is an heating element inside which blows up the fogging nature onto the scan. If you have seen my scans, there are no any kind of dull surfaces on the scan. That's because there is a constant heating tip which is there, and there is a very silent fan which is inbuilt within this. So the software features are very important. Once you pick up a scanner, it is not the hardware which is mattering. Hardware, as I mentioned, is more on the ergonomics part, but the software is very intuitive. It is so seamless and it is fast enough for me to pick up the right thing to do, and it's simple and superb. It is able to generate oral health reports, which is an amazing feature. You can just do a check scan and generate this oral health report and also increase your ROI in the clinic. You don't have to literally do a restorative work to educate the patient. Just generate an oral health report. He or she is so happy to see the report in hand. When you go for a blood checkup, you get the normal parameters and you get your range. So when you look at that range, you are immediately able to make a decision to go for the treatment. Similarly, no other technology was able to generate this report, where this AORALSCAN 3, a unique feature, which is able to generate an oral health report and also generate a QR code where the patient can immediately capture that in his or her phone. The other features which I think is needs a mention is that I am now moving on to choosing the tooth, which I am actually working on. Then I'm able to do a bite evaluation so that I know how much of clearance I've achieved and how much clearance I need to do. It is in both the fashions, in closed as well as in open mouth. So you can also use this to assess the bite stresses on the restorations. So this is a margin extractor. There's an automatic margin extractor, as well as you can yourself draw the margins at your freehand tools are available. This is to check the undercuts if there are any, and see the distalmost capture of even the wisdom tooth was possible by this scan. The AI function, which is important for us, the reason is when you're doing a scan, we don't need unwanted tissues like the tongue and the lips to be captured. The AI function can be switched on and switched off. When you're scanning the tissues or oral cavity, it is always an AI function should be on. And once your scan is ready, your files are in these three formats. One is the STL format, which is the standard format in 3D and digital technologies. You have an OBG format and PLY formats. So you can choose the format where you want to export this, and then the file can be immediately. the other greatest advantage is that from the scan itself, you can export it directly to the exocad. When we know there is a CAD-CAM systems, the CAD is important. So this exocad helps us to, so Shining 3D has an integration with exocad, which is one of the digital planning solution software for us. So that is very important when you pick your scanners, to see whether these scanners are open source and they are able to easily talk to each other softwares. So exocad, when I was talking about digital dentistry, it is not just the scanner. What we do next, when if you are picking up your journey towards digital dentistry, scanners are the stepping stones, and you need to plan that tomorrow, if you are upgrading to all these things, an exocad is a requirement. And these days, single restoration softwares which are designed, chairside softwares, a CAD software is available for us. So once this computer designing is done, it can be immediately. Tomorrow we are thinking of having an in-house lab as well. If you look, most of the practices internationally, especially in the US, are all migrating to in-house technologies. And I think other parts of the world are quickly catching up. And we are not left behind because the technologies are appreciable and affordable as well. So once you know about the software integration, you should also appreciate that there is a way to implement these technologies in a way that simulate your jaw movements. This is something where in your 3D printing, you can incorporate something called as an X-snap. This X-snap is nothing but an articulator kind of thing which can simulate your TMJs, which doesn't happen with your conventional techniques. You have to depend on articulators, fully adjustable and other things. But here, with upgrading to a digital technology, you can just buy the software where you can clip on this into your 3D printing or to the lab if it's possible, and simulate exact jaw movements. So this is possible in all the directions and exactly simulate your TMG. So the other software which you should know is that a CAM software. That means the software is for designing and there is a software for milling. These two have to be integrated, and seamlessly all this is possible if you're thinking of upgrading to become a standalone practice with a full-fledged in-house lab. So now, after talking about the scanner, what you need to really know is that should you upgrade, and if you upgrade, what exactly happens at the back end when you send these files to your lab. One and foremost thing is that first the lab tries to 3D print your models, unlike you conventionally pour the cast. And then you have the lab design your product. Then you have the milling machine. And then you have the sintering machine. I would like to make a mention of these two, milling and the sintering machine here, which is something latest in the technology, where the milling machine is able to do all the process, your zirconia, your glass ceramics, your metal milling in one machine, unlike the machines which are separately available. The other advantage today is that we were only thinking that it's only glass ceramics we can do a single day restorations. No, even with zirconia today it's possible. This is world's fastest sintering machine, which does the sintering of your zirconia in 30 minutes. It's from UNC. So the other thing is your furnace, ceramic furnace. If you want to do, if you don't want to do a full monolith crowns, then you'll have to rely on your ceramic furnaces. So now coming to my experience with having my in-house 3D printing facility, I picked up Shining 3D's AccuFab L4D, which is additive manufacturing. And I tried to put this picture on close to the plants. The reason is that it exactly prints as natural as possible. This is a scan of my son's mouth. And in fact, I tried printing it and I got all the anatomy exactly the way I am seeing him in his mouth. So I thank my son for clicking me such a wonderful picture for this, because I don't know, I just asked him to click a picture and he clicked at the background of the plants, which I would say it's completely reproducing the natural. What I wanted to tell you is that when you have a software, the same scanning software has an ability for you to design your cast before sending it to your 3D printer. So that's the Accu-design, which is inbuilt in your software, in your scanning software as well as in this software, that is your printing software, and it is very convenient, very efficient, and very accurate and quite quick to print. So if you can just see this after printing, this is the video which just pulls up the scan, and the next few steps which you can seamlessly follow it in your clinic. You are thinking that for me to upgrade to digital, it is expensive, it's cumbersome. No, this unit is so cute that every patient will start asking you, what is this such a wonderful gadget? And you can show this things to your patient, and your patient's acceptance towards your treatment will also increase. So this is the Accu-design model building software. So the process of 3D printing is that once it is 3D printed, you'll have to wash it with your isopropyl alcohol, seamlessly cut it out. As I mentioned, it's additive technology. There is no wasting of your printing resin, and this printing resin can be restored for your next print. So this is the AccuFab's print quality, and you can see the other print quality from another lab, which I'm showing you, so you can appreciate that. The other thing which I want to mention is that reinforcing of your 3D print models, which is built as an honeycomb pattern to strengthen the models. Usually, if you're printing as thin as this, it needs to be reinforced. What I've seen the labs doing is that they have an hollow model and they pour stone and send it back to you when they send those models, because they have fear of the models breaking. That you will not have with this, because the software itself has an inbuilt honeycomb pattern to strengthen this. So coming to a few of the cases which I can share with you today is this is one full mouth rehabilitation case. I used AORALSCAN. In this case, you can see that the tooth preparations were done with 2.5x Carl Zeiss loops, and all these preparations and the scan. And this is the STL file which was generated. You can see all the thing. The reason why I'm mentioning this case is that the patient was traveling in 4 days, and she lands up into my clinic and says she needs all these crowns and she needs to change her smile. So with the help of digital technology, I was able to deliver this in 4 days. And we also had a situation where she had a extraction to be done, and that healing. So we managed it well. And this is your 3D print casts and all the 10 crowns and also veneers in place. And this is the final fit. I never had any error in fitting any of these crowns, and all just fitted seamlessly, and patient was happy. And this gave me bouts of confidence in using digital technology, and I thank Shining 3D for producing such a wonderful scan tool which was made my practice, and also it enhanced my practice, and this patient is going to bring me more patients. So when you upgrade to a technology, you should also think of all these things in place. So the accuracy of scan of some of the scans, this is a cast, post and core. So you can see the accuracy of the metal scan. There are no errors. When I have actually worked on some of the scanners, there is when you have to scan the metal, you'll have to switch on a metal, scanning mode. But I don't use anything of that, but I can just directly scan. And you can see the inlay preparations and the 3D print accuracies, and you can see another preparation lower anterior and see the quality of scan captured. Scanning capabilities, that even if you have issues, as I mentioned, you have to isolate it. This is not the norm that you capture that, but I just wanted to see. I was trying to control the bleeding. Some patients land up in your clinic for immediate treatments, and then I also checked whether the fit of this, even with the bleeding situation, will it happen. So this is a complete scan of a post and core and also the metal. See the quality of scan. There are no errors or any shiny surfaces which are seen in the scan. Some veneer preparations and the post-ops for you. These are some inlays and onlays where you can really appreciate your preparation and appreciate the work done and how well the patient acceptance into treatment. So when you have digital scanning protocols and your magnification in place, you become more minimally invasive and you're able to generate biomimetic restorations. So the metal inlays. So additional capabilities. Here I want to make a mention that most of us, when we choose our scan, we also look at how to maintain it or how to preserve it. So you have Shining 3D having a cart where you can move this. but I designed my own cart where I can actually keep my laptop protected well after the scan, and the scan also can be visible and it comes out and goes in, and this can be moved between operatories. So this is something which I started trying now. I said that there are situations which I cannot scan using the scanner because the depth of the scan and this. Can I do a scan of my impressions? So what I did was a recent post and co case where I switched off the AI button. The artificial intelligence was switched off in the scan, and I was able to seamlessly capture the rubber base impression using my same scanner. This is not a lab scanner or anything, and you can see the other option of it. When you turn the scan, this is the image you get, and using this you can fabricate your post and code very well. So there are situations that don't think the scanner cannot do. It can scan anything and everything. It can even scan your face if you use it rightly. And only thing is, there is the scanning challenge is because it does not have reference points to catch up, but you can still scan for your moral and maxillofacial work as well. So we tried scanning the alginate impressions. That is also possible, but I wanted to make a mention. Just imagine what is the inaccuracies you can have. Irrespective of whatever kind of good experienced dentist you are, you can have the air bubbles within your alginate impression itself. When I turn my scan, these are the discrepancies or the the air bubbles which I captured. The other thing which I'm trying is try to capture the access cavity preparations just to see the depth of scan, and I was able to capture rubber base, means rubber dam applied, wherein the liquid rubber dam, the depth of the scan was really nice to check whether the scan is capable of doing that. Yes, you have a tool, you can try it, you can do much more things. I just gave you a glimpse of whatever I have tried till now in my practice, and some scientific evidence. When you actually pick up a scanner, you need to also look at the scientific evidence. There is a recently published article which was way back in last September 2021, which made a mention of AORALSCAN's capabilities and said that there were 10 scanners compared, and the quality of the scan and everything is comparable. And when you pick up a scanner, this is an article on that. So what I always tell you is that look at everything. It's not only my presentation, or I'm just trying to tell that this is my experience with AORALSCAN 3, and Shining 3D has made a product, and I think they're futuristically coming and developing constantly, and I believe that they will provide a complete holistic approach towards digital dentistry. And at Bangalore, I've been doing training on microscopes over 10 to 12 years now. And we are also starting a digital dentistry course where you'll have a complete workflow training starting from scanning protocols to milling protocols and sintering and 3D printing. You can get in touch with me. So, what finally I would like to say to all of you is let's go digital but with consciousness. This is my contact details. You can connect with me. I'm here also to answer your questions. And thanks Shining 3D and their team for giving me an opportunity to interact with all of you. Thank you for all the fellow dentists who's joined across the globe, irrespective of the time. And I would finally like to say thank you. Just scan it.